Hello, this is Dr. Cem Iyibozkurt. I'm a professor of gynecology and gynecologic oncology. I'm working in Istanbul Florence Nightingale Hospital, Turkey. I have completed my residency in Istanbul University, Istanbul Medical Faculty, and then I have also completed my gynecologic oncology subspecialty in the same hospital and worked there as an associate professor for a long time. Then I have exchanged my position to a private university, which I'm now currently working. I've been to Florida Hospital for a robotics rotation for a month, and I have also holding a PhD in molecular medicine, which I have completed during my subspecialty training years. Recently, I have completed surgical leadership program in Harvard University, Boston, for a year, which I have attended and graduated last year. I have been collaborating with the Bookimed platform for a couple of years now. We have patients coming from Canada, UK, and even Indonesia, Bali. So it's been a fruitful collaboration for us, and the numbers are still growing. I'm treating almost all parts of gynecologic oncology, including tubal and ovarian cancers, endometrial cancers, cervical cancers, and vulvar cancers. I also perform surgeries concerning fertility sparing treatments for both endometriosis and cancer surgeries. I do a lot of urogynecology and prolapsus surgeries also. I do myomectomies and hysterectomies, and I have almost more than 30 years of practice in these fields. Minimal invasive laparoscopy and robotic procedures have important advantages compared to traditional surgeries. The recovery periods are very short, and patients get up almost during the same day and discharged in 1 or 2 days. And the incisions are small, so the cosmetic results are better. We do state-of-the-art ovarian and tubal cancer and peritoneal cancer surgeries, including hyperthermic intraperitoneal chemotherapies. We also do fertility-sparing surgeries and V-nodes surgeries, which is very advantageous for cosmetics. We do robotics when indicated. Women should see their gynecologist regularly, at least once a year. We can offer HPV vaccines, which are important to prevent cervical pre-invasive and invasive cancers. For tubal and ovarian cancers, if patients have some form of genetic inclination, we use examinations and some tests and prophylactic surgeries for those patients. Otherwise, a yearly follow-up with pap smear and HPV tests plus an ultrasound would suffice for women. We take our patients as a human and as a whole, so we have a team approaching to our patients. We feel empathy for them and try to satisfy their own needs and tailor their treatments according to their needs. So that's what's different about our team and hospital. Sometimes oncologic diseases may have no symptoms at all, so a regular follow-up is important. But if you have abnormal bleedings or fullness, bloating, these are important symptoms. If you have a growing belly or something, you should also consult a gynecologist, and you should bear this in mind. Minimal invasive surgeries have 1 or 2 days of advantage over the traditional surgeries, and the recovery periods are quite faster. So if it's possible and if it's feasible, we always prefer to have a minimally invasive approach to our patients. We do consultations for Bookimed patients. Actually, we did consultations for each patient online, which contacted us through Bookimed. Trust is important, and seeing each other, touching each other with feelings is important in our processes. So we always do consultations with the patients beforehand. As well as in other diseases, gynecologic oncologic diseases also have some guidelines for performing these procedures, and we perform almost any of them. So if the patient is eligible to undergo a fertility sparing treatment, we do it in terms of surgery, chemotherapy, or radiotherapy. Having a treatment abroad, apart and far from your country, is always hard. So trust is also important in this aspect. We always do online consultations before and after the treatment processes, and we follow up our patients. So building trust can decrease these problems when you're having treatments abroad. You can reach us and we will be happy to assist you always.